You have many choices with your Medicare coverage. One such choice is between Medicare Advantage or Medicare Supplement plans. But what is the cost difference? Hi there, my name is Sarah and I'm here today with iHealthBrokers. Now if this is your first time to our channel, of course, welcome. At iHealthBrokers, we are licensed health insurance brokers and we're licensed nationwide. So if you have any questions whatsoever, please feel free to send us a message in the comments or you can give us a call at 888-410-0344. There is absolutely no charge for our services. And of course, please make sure to like this video. Liking this video will make it more visible to others who are looking for the same type of information. And don't forget to subscribe because we do release these videos on a weekly basis. Now, if you want to connect with us further, you can find us not only here on YouTube, where we've got plenty of videos about Medicare and health insurance in general, but on Facebook, Instagram, TikTok, and Twitter. So today we're going to be focusing on the cost differences between Medicare Advantage plans and Medicare Supplement plans. Original Medicare is Medicare Part A and Part B. Together they'll cover many, if not most, of your medical needs. But there are definitely still some gaps, which is why people look towards a Medicare Supplement Plan, also known as a Medigap plan, or Medicare Advantage, which is also known as Medicare Part C. But it's important that you don't confuse the two because they are entirely different. So Medicare Supplement plans actually work in conjunction with Original Medicare. They're not going to offer additional benefits, but they will cover those financial gaps. Medicare Advantage plans replace Original Medicare entirely. If you do choose to go the Medicare Supplement Plan route, then you will have to pay an additional monthly premium on top of what you pay for Original Medicare. Your monthly premium will be determined by a series of factors, basically your age, your gender, your location, of course the plan that you choose, and your carrier. That's very important as well. Now, if you enroll during your IEP, which is the 6 months after you turn 65, and enroll in Medicare Part B, you won't be subject to medical underwriting. If you enroll outside of your IEP, you may be subject to medical underwriting, which means you could be charged more or denied outright. But generally speaking, plans range between $100 to $200 per month. Medicare Advantage plans are different. They replace Original Medicare as opposed to working with Original Medicare. You're still going to have to pay some type of monthly premium. Now, many Medicare Advantage plans will boast that they are free. That is absolutely not true. At the very least, you're going to need to continue to pay for Medicare Part B. However, some plans will offer you a credit back on your Medicare Part B monthly premium. But remember, if you are receiving some type of discount or savings on the premium front, there's probably another way that the plan is going to make up for it. You could have a higher deductible, higher copays, or a much, much smaller network. So now let's talk about deductibles. Your deductible is the amount that you have to pay out of pocket before your insurance begins to contribute to the cost share. So with Original Medicare, and therefore a Medicare Supplement Plan, you have to take into consideration Part A, which is your hospital insurance, and Part B, which is your outpatient insurance. So for Part A, in 2022, the deductible is $1,556. This is applied per benefit period, which we do go into a little bit further in another video, so make sure to stay tuned to the end of the video because there's going to be a Medicare playlist, and you can scroll down through the description and I will put the link to that video where we go a little bit further into the Part A deductible because it can be a little bit confusing. But as I said, it is applied per benefit period. So if you need to be hospitalized or you need to take advantage of those Medicare Part A services, you will have to first meet that Part A deductible of $1,556 if you have only Original Medicare. Most Medicare Supplement plans will actually step in to cover that Part A deductible. Then there's Part B, which is your outpatient insurance. The deductible for Part B is $233 in 2022. There are actually no plans currently that will cover the Part B deductible, but again, it is a once annually deductible of $233, and after that, you'll be responsible for copays or coinsurance. Medicare Advantage plans are not standardized, so the deductible range can vary quite widely. Some plans will offer a $0 deductible, some plans have a separate deductible for prescription drugs and medical services, so really it depends upon the term of your plan. Make sure to check out the plans on Medicare.gov or speak with your broker to make sure you understand exactly what your deductible is. With either type of plan, once you've met your deductible, you'll be responsible for copays or coinsurance. With Medigap plans, the amount of your copay or coinsurance is determined by the plan that you choose. So let's take a look at Medicare.gov. So on Medicare.gov, there's actually a page for comparing Medigap policies. So if you just scroll down to the bottom of this page, you'll see all the different plans listed: A, B, C, D, F, which is no longer available, G, K, L, M, and N. And then over on the left-hand side of the screen, you'll see the benefits. So let's focus here on the coinsurance. So all of the Medigap plans will cover your Part A coinsurance and hospital costs. All of the Medigap plans, to some extent, will cover your Part B coinsurance or copays. Now again, Plan K and Plan L, those are the cost-sharing plans, so they're only going to cover a portion of the copays or coinsurance. For Part A hospice care coinsurance or copays, they all cover it. Again, 50% and 75% for Plan K and L. Skilled nursing facility care coinsurance, it depends upon the plan. So this won't be covered by Plan A and Plan B, but it will be covered by all the rest of the plans. With Medicare Advantage plans, also known as Part C plans, because they are not standardized, as I mentioned earlier, your copays and coinsurance can vary widely. So again, let's take a look at Medicare.gov so you can see exactly what some examples of copays or coinsurance with the Medicare Advantage plan might be. So I'm using the Plan Finder on Medicare.gov. I've just picked 3 random Medicare Advantage plans just so that we can compare. So let's scroll down. Here, of course, is the deductible, the drug deductible. We're actually going to get to this in a minute, but you'll see here that these are the out-of-pocket maximums. So this one has $1,200, $1,700, $3,400. Typically, this is a pretty typical range. We're going to keep scrolling down. So under benefits and costs is where you would see copays and coinsurance. So for a primary care physician visit, it would be a $0 copay with these plans. A specialist visit might have a $15 copay. It could be more dependent upon your plan, but again, we're just looking at 3 plans at random. You could have coinsurance or a copay for diagnostic tests, $25 copay, $0 to $30 copay, lab services, $0 to $50. $75, $90, $120 for emergency care. Urgent care visits, $10, $50, $0. So it is a pretty wide range because these plans are not standardized. Here's your Part A coverage, your inpatient hospital coverage. So this plan has a $0 copay. This plan, it depends upon your length of stay, and we're looking at $0 copay here as well. So as you can see, there's a pretty wide array of copays and coinsurance when it comes to Medicare Advantage plans. Finally, whether you choose a Medicare Advantage plan or a Medicare Supplement plan, you're going to have some type of out-of-pocket maximum. That is great news because with original Medicare alone, there is no out-of-pocket maximum, and out-of-pocket maximums can help protect you from major medical bills. Because most Medicare supplement plans cover most of the financial gaps of original Medicare, there actually isn't even an out-of-pocket maximum to take into consideration because you know all of your costs up front. The exception to this, of course, is Plan K and Plan L, which are those cost-sharing plans. So for Plan K in 2022, the out-of-pocket max is $6,620. And for Plan L in 2022, the out-of-pocket max is $3,310. Again, with Medicare Advantage plans, because they're not standardized, those out-of-pocket maximums can vary. Generally speaking, you're looking somewhere in the $1,000 range to a couple of $1,000s. As always, if you have any questions whatsoever about your Medicare coverage or health insurance in general, please feel free to send us a message or give us a call at 888-410-0344. We're licensed in all 50 states, so no matter where you are, we can help, and we are more than happy to answer any and all questions. And of course, like I said earlier, there's absolutely no charge for our services. And as always, please make sure to like this video, click that thumbs up button so we can get this information out there, and do make sure to subscribe because we release these videos on a weekly basis. Thank you so much and have a wonderful day. Bye-bye.